everybody. I am Diana from the Knee Zone, and I'm joined today by my husband and the amazing Dr. Raj Sinha.
Hello, everybody.
We're going to jump over to Ann Dooley on Instagram, and she has a really important question. So she's 7 weeks post-op, and she can't get past 90. And her ortho is suggesting a MUA, a manipulation under anesthesia, and she's, I'm going to say 7 weeks. And if you can drop in, I see you say past 90. Where are you right now? If you're here and can drop that, I'm curious to know how close you are to 90. Do you want to take this on?
Yep.
Because I think this is really important.
Absolutely. So number one, do you have full extension? And that's really important.
Which is straightening.
Full extension. That's really important to know because manipulation, MUA, does not reliably correct lack of straightening. So that's rarely a reason to have a manipulation. If you're flexing to 90 degrees.
Oh, she's at 96, she says.
Yeah. So 96 is pretty good.
Oh, yeah.
So,
at 7 weeks?
So a couple things I would say. Number one is when I see people who feel like they're struggling with flexion, I have them do two things. I have them sit on an elevated exam table so the leg is completely dangling and not touching the foot, not touching the ground. And I just let them sort of fatigue a little bit. And then I push on the knee to see what it feels like. If I feel springiness, which I call a soft endpoint, then I'm pretty sure they're going to be just fine. And I would hold off on manipulation at 7 weeks.
She can straighten completely.
Yeah.
So, Ann, you're at 96. You can straighten completely. You're at 0 as far as straight. And your surgeon is suggesting an MUA?
So again, my opinion, at 7 weeks, 96 degrees of flexion with a soft endpoint, I would not recommend manipulation yet. I would wait till about 11 weeks before I would consider that. And I would want to see if you sort of have just slowed down in your progression or have stopped. That's the first thing. The second thing is if you have a firm endpoint, meaning I push on it and it just doesn't give, then manipulation is probably better earlier rather than later. So that's an important differentiating factor, something to talk to your surgeon about. Like, why is it that they're recommending a manipulation? It's a little bit early. We usually have a 12-week window to do a manipulation and still have good results. But if they're feeling a firm endpoint, that might be a reason for them to say, let's go in there before it becomes even more rigid. And when I say go in there, I mean manipulate. That's not reopening it.
Yeah.
That's just putting you to sleep and gently breaking up the scar tissue.
Yeah, in case any of you are curious about what a manipulation under anesthesia, MUA, is, that's what happens.
Research data suggests it can be as high as 3 to 5% in the total knee population. I have not seen it that high in my patient population, but I'm very aggressive about controlling pain. And I think pain is the primary reason why people get stiff and need a manipulation.
Let's see, don't take their pain medication on schedule, which is what we talked about in the very beginning.
Or they're afraid to.
Yeah, I get it.
I think, all the concern about opioid addiction and things like that, that's real. However, there's a couple things I'll say about that. I have so many things to say about so much stuff.
But there's a few more questions, so
okay.
Let's not get carried away.
I'll be quick. So what I'll say about that, number one is, if you were not taking opioids before the surgery, it's okay for you to take it out to about 3 months. That's all right. I cut my patients off at 3 months, and I tell them that ahead of time. Because if they're still taking it after 3 months, then there's a high chance, like 15%, they'll be taking it at 1 year. That's a problem. The second thing is, data shows that if you control your pain well early on, like the first 72 to 96 hours, you actually wind up taking less pain medicine overall. So people who are concerned about getting addicted in the first week, that's not going to happen. That's not how pain and addiction work. You won't get addicted until much later on. So control that pain early on if you need it. However you do it, ice, elevation, anti-inflammatories, some surgeons prescribe steroids, definitely acetaminophen, Tylenol, and then opioids as needed.
Thank you. All right, we're going to say goodbye to you, our friends. We hope to see you next week. If you want something, just drop guide or go to thekneezone.com. Scroll on down and you can drop and get it right there right away. Thank you all. Thanks for enduring our experiment today.